super excited to be at HIMSS this year. My name is Mike Riley, Director of Healthcare here at IPORT. We've got a number of different app partners that all drive that connected care experience. So one of the easiest places to do that is just in the check-in experience. So if you go across the care continuum, a lot of that check-in experience is still pen and paper, what it was 20, 30 years ago. This is our pillar product. Put my patient information in, I can scan shortness of breath, symptoms, etc. Using ScanIt, which is one of our other partners, which transforms the iPad camera into a powerful barcode scanning app. I can scan my insurance card, my ID card, all that's intake directly in the EHR. Or I could have iPads available, pop it out of our multi-dock, so the patient could go sit down in the waiting room and do their patient information, scan their insurance card ID, all that's automatically intaked in. Saves each patient about 10 to 14 minutes before they see their care team. In a shared device deployment, there's a lot of cables. A lot of these devices go missing. There's not a lot of telemetry on who had a device, much less the app utilization of that device. We've got a really cool partner called Streamline. And Streamline has an app called iEnterprise that runs natively on the iPhone or iPad. If I'm a nurse coming in for my shift, I pop out one of our iPhones. These are in our cases. No cables to plug or unplug. I literally can authenticate in just with my face, so it's now assigned this device to me. IT knows who has the device. Your unit managers, your charge nurses know who has their pool of devices as well. So when I'm done with my shift, I put the iPhone back in. It automatically does a wipe and reset, so it's ready to go for the next caregiver. Our chargers do a 50% charge in under 30 minutes. It's ready to go for the next care team. Now, one of the really cool things that iPORT enables is that real-time documentation at the point of care. So one of the issues that caregivers have is they don't like typing directly on the iPad. Some feel very comfortable, but some don't. So what we enable are these kiosks mounted throughout the health system, maybe inside a patient room or outside a patient room, where I literally just go, it's magnetically mounts, docks in, I can do a keyboard and mouse chart, pop it off and run. I can pop it on a cart if I want to, type, do my work on the workflow, pop it off and go. And then when I'm done, I put it back in the dock, and it does the setup and reset, so it's ready for the next caregiver. Really excited about this next app to introduce you to. It's an app called NoaFace, and it replaces the old expensive purpose-built time clocks. So if I'm a nurse or a caregiver or a shift worker coming in for my shift, I literally walk in, the camera recognizes me, and I start my shift. At the end of the day, the same thing, I go up, the camera recognizes me on the iPad, I can adjust it based on height, and it clocks me out at the end of my shift. These solutions are super simple. They're 1/10 the cost of some of these purpose-built devices, and they can get your caregivers and shift workers in providing care very, very, very efficiently. And they can even record sentiment. Hey, at the end of your shift, how was your day? Did you feel supported by your care team or by your administrators? What can we do to better help you? So one of the other really cool areas where health systems are really trying to drive that connection with their patients is at the bedside. So a simple, easy way to do it is to have an iPad held, charged, and protected with iPORT. It can either be mounted on the wall or one of our convenient base stations. The patient pops it off, and we've got a really cool app called DigiValet. And with DigiValet, I can control the temperature in the room, the lighting, the shades, things that I would typically have to call the care team to come in and handle. I can do it all right there. And I can order meals, keeping in mind my dietary restrictions. It's paired with a TV in room, an Apple TV in room, so I'm able to have all sorts of entertainment and multimedia right at my fingertips. I can even have surveys sent to me each day. How is your stay? So you're giving that real-time feedback on how the health system can make the patient more comfortable. And at the end of the day, if I'm using this iPad for all this in-room entertainment that's helping relax and comfort me, I'm more likely to get into my chart, start learning about my treatment, interacting with my care team. So I'm coming out of the hospital ready to go, so I'm not admitted back in the hospital afterward. And then moving on, our parent company is a company called Sonance. They make incredible high-end sound systems for high-end residences, for commercial properties like Nike. They also do it for health systems as well. So a really cool use case for healthcare, Wellstar, trying to help with caregiver burnout, created these rooms where a caregiver can come during their shift when they want to relax. It has Sonance speakers going, along with iPORT's cases, and an iPad in there running spatial audio, which enables the caregiver to relax. So it's doing layered sound. So you have nature sounds, ocean waves coming in. They started with one pilot. They've rolled it out to 60 different sites because they had such positive feedback. They're now doing the same thing in their labor and delivery department, helping expectant mothers and laborers relax. So iPORT, Sonance, and other partners like Spatial are really enabling health systems to relax their caregivers, so helping with fatigue and burnout, but also helping expectant mothers feel more comfortable during the delivery process.